Bonjour and greetings and kia ora from New Zealand. It's great to be here with you, and what a fascinating topic. So I'm going to run through some presentation which is really very much looking at a health perspective on some of these issues. So I'll just share my screen, and so hopefully you're all seeing that those slides.
Yeah, we do.
This is really an issue, I think, for every country on earth, is how to manage its borders during the pandemic. And so my perspective is a public health one, as you'd expect. So just a bit of background, I'm based at the University of Otago in Wellington. We're a branch of the mothership, as we say, down in Dunedin. And this is a clinical school, and I work in the Department of Public Health there. Like several of you, we've already lived through a number of pandemics. I got interested with HIV/AIDS at the tail end of that era, and then SARS, another coronavirus that didn't have a big impact in this region, pandemic influenza, and now COVID-19, which we have to say is this sort of white knuckle ride. I think it's now a little bit more settled, and that we know a lot more about what we're dealing with at this point. So today I'm going to run through quite quickly a few key themes about our choices we have to make, the elimination strategy, its impact, based largely on the New Zealand experience, how the pandemic's progressing, and then some of these key questions around vaccination, borders, strategic choices. What are some of the key lessons for the future? So we all know what a pandemic is. It's a form of epidemic. So it's just more than you expect of cases. We have lots of outbreaks that are localized. We fortunately don't have many pandemics that are widespread. Of course, the actual definition of a pandemic is a bit fuzzy. It's not actually, we never declare a pandemic. You only declare a public health emergency of international concern. So, of course, there's a rich history to draw on, and we realize that looking at past pandemics is helpful, but it can also trap us into previous ways of thinking that aren't very useful. And I think in many ways applying the influenza paradigm, and obviously this is really the metric of a pandemic, and other flu pandemics that happen about 3 times a century, takes us down a certain path, which I think was quite wrong for the COVID-19 pandemic. And we're really unlearning some of those ideas at the moment. So if you're an infectious disease epidemiologist, you realize when you're confronted by any serious disease, you've got this big fork on the road, assuming you do something. So for trivial illnesses, we may not have a strategy. Generally, we want to control things, which is reduce their incidence and impact. Occasionally, we want to eliminate things. And I guess it's a minority of diseases where we can do that. And within the control paradigm, you've got mitigation, which is the traditional approach to pandemic influenza. And then you've got suppression, which is a much more vigorous approach to dampen down transmission. And this is the dominant model across you'd say, the high-income countries and some of the middle-income countries. Elimination, reducing to zero in a country or region, it's a very well-established model. I mean, we do this for polio, measles, rubella, and some other infectious diseases. So there's nothing exotic about this idea. In fact, the World Health Organization, of course, has many elimination strategies. Occasionally, at a global level, you can achieve eradication, but that's really quite a high bar to do that. We published a piece in the British Medical Journal just before Christmas last year, where we tried to summarize the different paradigms for how to respond to pandemics. And so we really pointed out that if you're aiming to to basically stamp out all embers of the virus, so if you use the forest fire metaphor, to have no burning cases, then you've got an elimination strategy or an exclusion strategy. And this is really a dominant model for many island states. That is, you just do not have the virus in at all at any point. You lift up the drawbridge and stop it. Whereas elimination is more applicable to countries that already had an incursion of the virus and had to stamp it out. But the goal is to try and return to this carefully managed new normal within a few months. And this has been achieved by a number of countries. Otherwise, you're in a suppression or mitigation approach or no substantive strategy. So this is really the same as my last slide, but it's just shown in a slightly more analytic way. And so this is this is a freely downloadable article just before Christmas that you can look at. So early on, when we looked at the success of China in stamping out COVID-19, by the end of February, there was a very good report which said this could be done. So we promoted an elimination strategy in New Zealand and published this quite early on. And the elements of elimination strategy are very familiar. Exclusion of cases is absolutely fundamental. Keep it out at borders. The ability to stamp out chains of transmission, testing, contact tracing, preventing community transmission. And again, we had limited options such as mask use and physical distancing, and now more recently, vaccination. And then some sort of social safety net to protect the most vulnerable. So we have these truly remarkable graphs that no one ever thought they would see. This is the number of inbound travelers to New Zealand by week. And this is the normal baseline. And this is what happened in March last year. This dropped to a very low level. And now I just updated this and of course have added in this more recent period of opening up the travel, the green zone with Australia and now the Cook Islands. So this is a gradual, very careful opening up. So the other part of the strategy, of course, is testing, contact tracing, and many parts of the world now have a huge capacity to do testing. This is the New Zealand amazing contribution by our laboratory scientists to be able to do this high volume testing here. And the third part of dampening of the elimination strategy is dampening down transmission. And really, we needed to switch from traditional methods, relied on staying at home, washing your hands, and coughing and sneezing, to adapt to this virus where there's a lot of asymptomatic transmission and it's respiratory droplets and aerosols. You basically have to use masks. And that's mass masking, source control, and improved ventilation and filtration. For my efforts for promoting masks, I'm now immortalized on some mask packaging that's sold by Te Papa in Wellington. So the other part of dampening down transmission, of course, is physical distancing. And New Zealand had developed a 4-level alert level system, which is really a way of summarizing in a simple way a whole lot of different practices designed to reduce transmission and mixing between people and limit travel. And so this is a tribute to big data. This is showing the fact that for every country on Earth, you can go onto the Our World in Data site, which is a great source of information. And every country on Earth now has the stringency index assigned to its lockdown measures by day. And this is showing for New Zealand, we really were Olympic champions of lockdown. We went way up to the highest possible level for 5 weeks and then 2 weeks at a lower level, and we emerged into a virus-free country. We since had one more significant lockdown in August last year and a yo-yo lockdown in February of this year, and both of these were to dampen down, extinguish outbreaks in Auckland. We've had far less lockdown than, say, the United States or Sweden, which are often were, in the case of Sweden, given as an example of a country which had a light touch, where actually elimination is a much lighter touch than many countries pursuing suppression. So the impact of the elimination strategy is if you do it very vigorously and effectively, you extinguish viral transmission, and this is showing how these measures were phased in and out. And we got off this exponential rise and then had this exponential decay of the virus in New Zealand. And we then went for 100 days with no local transmission. And then we got an outbreak, which I mentioned. So what's the net effect of the elimination strategy? This is showing mortality rates per million. And this is looking at the countries pursuing elimination: Taiwan, China, New Zealand, Australia, with low mortality. This is deaths per million. And then some countries that are in an intermediate position, South Korea and Japan, have a suppression, and quite a tight suppression approach. And this is really showing the pattern in Europe of very high transmission and mortality. And if we look at how many lives has this saved in New Zealand? If we had the mortality rate experienced in Sweden, which has lost 0.14% of its population, we'd have lost 7,000 people in New Zealand now. So that's the number of lives saved by doing this. And an average of 16 years of life lost per death is the current global average. So it's a big impact. We also had an interesting effect in New Zealand where we avoided excess winter mortality, and that saved another 1,500 lives who would have died over winter. So one of the things we looked at, and sorry, this is a very busy slide, was the impact of elimination on economic performance. This is in that same British Medical Journal paper I mentioned. And this showed we got much lower mortality, but we also had a much better economic recovery for countries pursuing elimination compared with suppression. So where are we now? Well, this is right up to date. What's the progression of the pandemic globally? Well, if you just looked at numbers, we're in a worse situation now than we were a year ago in terms of the impact of the pandemic on global health, in terms of cases and the sustained high mortality of more than 10,000 deaths a day now for several months. So we're not globally in a good position at present. We look at the Pacific Islands, obviously it's a much better situation overall. This is showing COVID cases per million population for countries in this region. And you can see that we've had significant outbreaks in New Zealand and Australia, and now much better control. And more recently, as you all know, problems with Papua New Guinea and Fiji with rising numbers. And again, Australia and New Zealand occasionally, and other countries occasionally having to battle outbreaks. So again, there are other people on this call who I hope will talk more about the situation across the Pacific. Obviously, ongoing outbreaks in a number of parts of the Pacific. And I think very often in countries where there has been early opening, partly I think because of pressure for the tourist industry to be sustained because it's such a vital part of the local economy, but that has obviously caused problems in a number of Pacific states. And again, these data will be very familiar to you from the Pacific community, showing cases and deaths. These are cumulative numbers for countries across the region, and I'm sure you're very familiar with these numbers, really showing significant problems in states that are under the control, I think, of or sovereignty of the United States and France in particular, and then problems for Papua New Guinea for other reasons over this period. So vaccines is a truly remarkable achievement, as we all know, developing vaccines so rapidly that are effective and safe, and a number to choose from. Still some uncertainties. This is a general approach, say, in New Zealand and Australia, and the only thing that's different about elimination countries is they have a priority group of border and quarantine workers. Otherwise, it's very similar to the rest of the world, which is protecting high-risk frontline workers, health workers, and then more vulnerable populations, and then moving into everyone else. So a very rational prioritization of vaccines. One of the big questions is how many people do you have to vaccinate to reach the herd immunity threshold? It's driven by how infectious the pathogen is. And we can see that for COVID-19, which has a reproduction number of around 2.5, you need to vaccinate theoretically 60% of the population, but probably slightly more because the population is mixed and you have pockets of low coverage. So how well do vaccines work at a population level? We only have to look at the United States and the United Kingdom, which are now rising up to 50% or more of their populations having had one or more doses. And we're now seeing this marked decline
I'm afraid we've lost both. It's okay. You're back, Michael. You just evaded us for 15 seconds. Seem to be back, but you're muted now.
Sorry.
Now you are back. Thanks.
So hopefully you can hear me all right, and we'll carry on. So just pointing out these huge inequalities in global vaccine coverage. Oceania is now having this big leap up very rapidly, but we still have a long way to go to reach the coverage of some of the high-income countries. And another key aspect, of course, is borders. This is showing the fact, if we look at the epidemic curve in New Zealand, these blue cases are those that are safely held in quarantine facilities at borders, and these reds are showing occasional border failures, which are generally very small in scale, except for August last year, causing very few cases. But this does require a very high level of attention to detail in these quarantine facilities, and also very effective case or outbreak control measures. So just thinking about how do you manage borders, it's important to think of this as this continuum from pre-departure, during flights, quarantine, and post-quarantine. And so one of the things we've really learned in New Zealand is the key single most important measure if you're going to manage borders is what you could call a traffic lights approach. This is risk assessment and risk management, where you have to apply a different approach depending on the level of virus transmission in the source country. So we've now opened a green zone with other countries that are eliminating this virus, amber zone for the rest of the world, and then this red zone for countries that have got very poorly controlled pandemics. This is limiting travel from those countries. And this is what is really allowing New Zealand's border controls to be sustained at the moment. So where do we go to from here at a strategic level? The choices really are this approach here of basically suppression, which is where you have endemic infection, where you accept that COVID-19 is here to stay and you vaccinate the vulnerable. The alternative approach is what we call progressive elimination. This is what we do with measles, and this is you get high vaccine coverage and you use public health measures to dampen down transmission. It even makes global eradication possible. I don't think this is likely at all at the moment with this virus, but I do think progressive elimination has a lot of benefits. At least is certainly preferable, I think, to endemic infection, but I guess it still has to be answered. So what are the key lessons for the future? I think some of them really are around better approaches for tackling public health challenges, and that's using evidence. I think adapting to all hazards, having this public health infrastructure and global health institutions like the WHO, and really seizing opportunities from this reset. My biggest single lesson really is that we have to have this amalgam of effective science and good political leadership to give us this evidence-informed decision-making. And I think that's been a key factor for countries that have done well during the pandemic. And looking ahead, this is, if you look at things that have a high fatality risk and things that are quite or very, very transmissible, these are the things to worry about in the future. Flu pandemics, smallpox, other emerging zoonotic diseases, and I think novel synthetic diseases from bioweapons. I think these are quite a terrifying prospect, and unfortunately, I think that the possibilities are getting higher. So that's why I think it's vital that we learn as much as we can from the current pandemic response and really keep these lessons and build this infrastructure to manage these threats in the future. I'm also think that this infrastructure is also very valuable for the green recovery and thinking about managing, obviously, climate change, environmental destruction, and looking towards equity as a key threat or an opportunity to do much better to promote equity. So just in summary, so it's very rushed. I think the evidence is that elimination strategy is the optimal response for new emerging infectious diseases. From a health and economic perspective, it can be achieved and sustained with public health measures, including border management, high vaccine coverage, and probably both. But I think tight border management will be needed until we have high coverage. And some public health measures will almost certainly be required in the medium to long term to manage this virus threat. Thank you.
Thanks very much, Michael. Very comprehensive. Takes us through the whole picture of the sanitary government strategic side of this. And thanks for being right in time. I will raise one question before we move to the next presentation. And pardon me for exercising my duty of trying to keep the clock exactly where it is. I think New Zealand has been a very successful example. How much in this success, Michael, is the fact that you are an island?
Yeah, I think New Zealand has huge geographic and socioeconomic advantages and timing, and also a bit of luck, good luck. So I think all those things have helped. The country that's most impressed me has been Vietnam, because with 100 million people, a long, complex land border with China, and being an emerging economy, they basically managed the pandemic as well as New Zealand, or better, I think. I mean, they've done exceptionally well. And so have a number of other countries in Asia that really had a lot of obstacles. So I think that's what convinced me that basically anywhere can take an elimination approach if I think it has sufficient, certain requirements need to be there. And I think leadership, science, infrastructure, and some resources, and a country can do it. I mean, I think that's been demonstrated, particularly in Asia. Actually, Pascal, I think you're muted.
If there's a technical problem, I can maybe take over. Pascal, it's up to you. We cannot hear you. Can you hear me?
Yeah, I'm back. Sorry about that.
Okay, no problem.
Sorry about that. Thanks for stepping in, Vincent. It's great to have you as a
no problem, please.
Stepping in immediately. Michael, I must say I was very impressed by the answer to your question. Humble, precise, but the lesson from you is that elimination is the right strategy, and that this can be done even if you're not an island, and that's a big lesson for the future.
Yes.
Let's now move to the next presentation by Vinup Gul and Matteo Zanarini. Please, both of you, step in. And again, great thanks to Michael. Having listened to him, we know how to make it work. And that's incredibly optimistic for the future, although with a lot of attention and focus on the strategy. Let's move now to Vinup and Matteo.